afternoon.
You glorious son of a bitch. How's things?
Life's pretty good. I'm sitting out here on the deck. I decided against doing this podcast from my bed.
Well, mate, as a chiropractor, you should know better about sitting in an L position in a bed. That just adds stupid amount of load to your. But mind you, I was quite jealous that you managed to just be lounging around in bed at the middle of the day. Well done.
Gotta love Mondays. Mondays are awesome. I've had a very productive day. I've done my brunch planning schedule for the week. So went and had breakfast late with my lovely wife, dropped the kids at school, and then started discussing how the week's going to go. Hopefully today is the day that the lawsuit against the previous cryo supply company gets introduced to the courts, and my life gets to be a little less anxious.
Mate, that's fantastic.
Well, it will be.
Monday, on the other hand, so after a sleep, my little girl is sick at the moment, so neither me or the wife is sleeping. I still decided to wake up at 5:30 and rush off to BJJ for an hour.
Good idea. That's
but then
never a bad way to deal.
On the drive home, I managed somehow to pick up a giant bloody nail in one of my tires. So
no.
There's an hour of my life gone at the local tire repair shop fixing that. And then get home, and then this is the week that I do pays and admin for when I say I do it, what I really mean is my wife does it, but I sit there and give her the data, and she does it all for me. Nevertheless, it is quite stressful.
Yes,
but so polar opposites, and then funnily enough, I'm up to my second coffee of the day. Because Monday has not quite kicked my ass a little bit, but
no, I have.
I'd imagine me just having that little whinge. There are going to be people out there who have genuinely gone through a tough day, and they're listening to me rant about my bullshit. Oh, poor Eric, what a diddums.
Yeah, well, this morning I've been informed by my lovely wife that she's already done the pays for the week for last week. And we, because of the lawsuit and having to keep everything funded while I still pay the bank for the machine that doesn't work, etc., I've had to let 2 staff members go. And so this is the first week that we only pay 1 staff member.
That's got to be a little bit easier to manage.
Well, it is, but it means that the family's taken a bit of a hit. Nikki's, having
to
step in. The kids are having to rally around. The busing to work after school. There's a whole lot of change, and of course, we had a bit of stress around that. Of my littlest one catching the bus by herself straight after school, coming into work, and there's a lot of growth that comes out of it. But we again had a fair bit of anxiety with the what if something goes wrong, and you work up these things through your head, stressing yourself, and the what ifs and the maybes. Fortunately, everything's basically gone swimmingly, and overall, I think the family's come together fairly well because of it.
That's a very neat segue. So, I mean, briefly off, we had a quick chat about the topic of the day being sort of anxiety, but yeah, just with me having a little whinge and then you having a little whinge. Let's talk briefly about sort of stresses in the eye of the beholder.
Yes.
So like my perception of what is stressful may be drastically different to what someone else's level of stress may be. And it's very much you stress out, or the physiological problems that go along with stress is very much on how you perceive an event to be stressful rather than...
That's it. That's really it. So the way I define stress for my my patients and myself is anything that challenges the body in any way, shape, or form that requires adaptation. So eating something good for you is stressful. Eating something bad for you is stressful. Getting happy is stressful because it releases adrenaline and cortisol. Getting unhappy is a stress so what it comes down to is whether your adaptation brings you in a positive direction, which invariably comes down to your perspective and your learned experiences. So lots of people win $1 million and they get really stressed and depressed by it. Whereas I'd look at winning $1 million and go, oh, I can do this, and I can take time off to go and do some full-time study, and I can and I can think of all these really positive, happy things that $1 million would bring. But when you look at the end results of people winning the lotto, ending up with no money at the end of it, really messed up and stressed and depressed, it comes down to how your brain perceives it and what direction your pre-programming has gone in that makes you think good or bad things about it.
Was that a interesting seminar? Shout out to Luke Curry from KC Sports Chiro. But one of the things they were talking about specifically in the realm of exercise rehab or exercise science was that there's your physiological sort of potential or what you can physiologically manage, which is like the easy zone, doesn't cause any tissue trauma. It's basically your everyday function. And then above that is your sort of it's more stressful style exercises, which is still less than traumatic. So it's sort of more than what your body is geared for, but not enough to cause trauma. And then if you go beyond that, you're hurting yourself. And then the goal of exercise was to sort of hit that red band sort of beyond what the body can tolerate, but not so far that you're going into trauma. But it was also, you don't necessarily want to stay in that above what your body can comfortably handle for too long. But I'd imagine there's a fair bit of crossover with anything that's stressful. Like if you're having to study for an exam that's coming up, you can sustain that sort of beyond what your brain is currently geared for a short amount of time. But if you stay in that red band for too long, there's going to be problems associated with that. Do you feel, because when some people are going from a, so let's say I have stressful days where I'm at the clinic for 12 hours straight, and it's go, and I generally can do 2 or 3 of those a week. But if I get more than that, then I start to break down. I lose track of things and nothing works. So I've made sure I don't do that anymore. However, there are people out there who are doing significantly more. So that's where, and then there's other people who have been burnt out by that. So do you want to comment on the, what's the difference between me sort of sustaining like 2 full days like that and developing adapting to that and then being able to do that for 4 days and 5 days, like some people do, versus people that do 2 or 3 days of lots and lots of work and then start to crumble underneath it and then say, look, I can't sustain that. I can only do 1 full day. And then pretty soon they can't even do that. They're only down to half days, see chronic fatigue.
Sure. So there's a couple of interesting ways of looking at that one, I think. One of which I'm basically going to use a very touchy-feely word called joy. And I think joy is a really important part of the answer to that, because there's 2 ways of answering it. One is the biopsychosocial catch cry, which is where joy comes in, and the other is just purely a biochemical, biophysiological response. And so in both camps, you have the biophysiological response. So no matter what, you have to generate enough energy to generate enough brain to move the muscle to do a 12-hour day, back-to-back patient, and come out the other side of it. And what's meant to occur is that you finish the day and you have a sleep and you eat and you refuel and you get up and you do it again. And theoretically, if your brain can tolerate it, you can do that, okay? So you can teach your body, as I have done, to learn and adapt to 12-hour days. Generally speaking, I start seeing patients about 7 a.m., and I will generally finish seeing patients somewhere between about 6 and 7 p.m. most days of the week. So I'm in that stupid category, but I have much longer appointment times probably than most other chiropractors out there do. Generally speaking, my appointment times are about a half an hour long. So to actually stay in business, I actually need to run, more time to see less people because they're that long, rather than, 10-minute slots where you see 2 or 3 patients kind of across the board. I just don't do that sort of thing. But
curse of ethics, mate.
Yeah, well, I want actually people to become well. I think that's really the point. Is the difference in it is probably that if you feel emotionally that there is a joyous light at the end of the tunnel, a payoff, a benefit, then the physical output gives you enough hit of dopamine and serotonin and endorphins that you can look at your work and feel good about it, that it was worthwhile. And this actually entrains you to feel that the output that you did to get to whichever endpoint is beneficial to you. Whereas if all you're doing is going, I did 12 hours and I earned X amount of money, we'll say $1,000. We did a full day, we earned $1,000. And then you get to look at, like on Monday, and you look at your books and you go, and I've got to pay that, and I've got to pay that. And if all we're doing is looking at it as an endpoint, which has no intangible. Now, note what I'm saying. Money is still, while it's an intangible real concept because it's a placeholder for anything of value, we can still touch dollar notes, and we can still look at a computer screen with zeros and ones and go, right, that's money. And if all you're doing is doing it to chase the money, then the 12 hours of work to earn that $1,000 really doesn't provide you a sense of anything,
purpose.
A connection, a purpose. And I think that's really what creates, the why is what creates the stress. It's the perception, and that's why everything is actually stressful, whether it's a joyous thing or not. It's just how your brain teaches you to adapt to it. And I've been studying a concept. I was reading a book, and still am recently, called Lost Connections. And it's particularly pertinent as my middle daughter, may she never hear this because I'm talking about her, has a diagnosis, amongst other things, of anxiety, social anxiety, and finds it really difficult to talk to people. And so one of the things that I've been doing is trying to actually give us as a family a sense of identity. So I've got an identity. I'm the odd chiro chap kind of / nutrition medicine / kind of whatever I am. And I'm happy with what I am. And I'm the person that people will kind of attend when all the other practitioners have sort of failed. I get those sorts of referrals and chronic cases. And I've built my own personal image around that. But my daughters, some of them are born in New Zealand, some of them are born in Australia. My wife's born in England. I've got American citizenship as well. We don't have a solid identity or group or otherwise. And I think this actually creates a great degree of stress for my daughters, even though, like someone from the outside would look at them and go, right, well, you live in a nice middle-class neighborhood. You don't want for food. You don't want for clothes. You've always got enough data on your iPhone. There's nothing that they actually want for, yet they still have stress. They have anxiety. And so it's got to be a bit more than just a lack of biochemistry. However, that said, after having run my daughter's her hormone test, you know how I was somewhat disparaging of other people's hormone levels on it. This is one of those really odd moments. My daughter's cortisol level was literally off the chart.
Oh, right. Off the chart high or off the chart low?
High. So it was about the range again above where it should have been.
Okay, wow.
Her daily melatonin, because she doesn't sleep, she used melatonin for a while, as prescribed by the pediatrician. And so it's meant to be daily melatonin's got an upper limit of 85. Hers was 4,400.
Whoa.
Okay? So there's no chance.
Still not sleeping.
And still not sleeping. No.
Wow.
Chronically tired. So where this becomes a problem is we've been trying to biochemically balance her system and deal with things. And, we're doing all the right things. And so now I'm taking a much more biopsychosocial concept going, right, well, I know my daughter is stressed. I know that if anyone kind of outside looked in and went, well, you want for nothing, et cetera, she's got loving parents that she can kind of say, yeah, but I don't feel you love me. I'm not connected. And that's really what I think it comes down to. Because we don't have a solid identity, we can't say, oh, look, I'm Greek, I'm Macedonian, what's a Kiwi? What's an Australian? My Australian-born daughter doesn't even get to count as an Australian because we're in the quasi-indiscriminate spot of being New Zealand citizens, which means we don't really count as permanent residents, but we're not New Zealanders anymore either after 15 years.
Queenslander, but you still go for the All Blacks.
No, I don't. I go for the Wallabies. We got smashed.
See, that you're well and truly assimilated. That's you're fine.
Yeah, no, but I mean, look, we're going to keep that on the low because Argentina smashed us, man. That's not a great sign.
But I think to your point, there's a good book that I haven't read myself, but I've heard reference to. But they do talk about the importance of being involved in a group culture, or that 150 friends, or after 150 people, you can't really you lose coherence in that group.
Absolutely.
But I think you touched on a really good point where, with any sort of anxiety and stress case, you can bash on the whatever the mechanistic cause for it may be, from a nutritional substrate to a there could be vestibular compromise, or brains just become hardwired for stress. But you really need to be collaborating with someone who can touch on that biopsychosocial. I mean, that's certainly well outside my realm of expertise. But
see, I don't think it is. I think realistically, one of the things that chiropractors, I think, do really well is we tend to connect with our patients. Now, we look at the wellness model, and especially the wellness people, and while you and I might not necessarily agree with how they necessarily do things, the just adjust them approach might not work. What they do really well is they talk to their patients and they connect with their patients and they give them another storyboard to reference themselves from. And I think that's one of the things that really makes a difference to people out there, is not whether their spine gets manipulated or they get given a pill or otherwise. It's that they're listened to and that they're given another way of looking at themselves and referencing themselves in the world to feel secure. And we practitioners tend to do that better, or so the reports go, than many others. And the most successful practitioners of any variety out there tend to be the ones that actually connect to, listen to, and touch. And you can use that word very kind of loosely. You touch meaning kind of connect to the spirit of the person, the being, or as much as anything. I think one of the reasons why physical practitioners, physios, chiros, massage therapists, etc., do well is we actually touch. We sensorially integrate with our patients, and touch is one of the most important things for decreasing anxiety.
What's interesting with have you read that Susan Herdman's book? It's the vestibular rehabilitation. I've forgotten the full name of it. But there's a paper that I'm pretty sure she didn't come up with, but she may have referenced. It talks about in the ideal human, as you're walking around with your eyes open, 60% of what you use to orientate yourself is proprioceptive, and then 20% is vestibular, and the last little bit is ocular. Your eyes. Yep. But then as we age, we tend to become more vision dominant because we lose that effective proprioceptive input, either through chronic lack of stimulation, B12 nutritional consequences, let alone the ankle roll that you did 30 years ago and never really got sorted. And then we also know that the vestibular compromise tends to increase as we age, so you become increasingly vision dominant. So anyone who does restore that sort of proprioceptive, like that touch, that can be a huge thing for restoring a normal sense of orientation of you and your space. Because I do a fair bit of vestibular rehab work, and certainly one of the biggest drivers for anxiety. I mean, obviously, I'm getting a skewed population because people are coming in to get vestibular rehab, and then I happen to be going, so are you anxious? And they're like, yeah, well, of course. I don't know which way down is. Yeah,
but most of them won't say that specifically.
No.
Most of them
unfortunately
will go, yes, I'm anxious, and then you create a storyboard for them, I would suggest, saying, well, look, if you don't know which way up and down is, your anxiety will go up. And that's really normal. And because you're actually telling them that it's normal because of this problem, they go, oh, that makes sense. And they can actually relax about it. Because as I put it to you, anxiety is the monster chasing you that you can't see. You know it's there, but you can't see it. And you're like, something's wrong.
Yeah.
And because no one kind of puts an appropriate meaning, story, or explanation for it, they stay winding. And this really makes a mess of their brain.
Yeah, you're right. There is something powerful about understanding the mechanism behind anxiety, or putting a storyboard to the beast, so that you can start to break it down into chunk-sized pieces and beat it up.
Eat it. The other one that you did, you were out there this morning doing it, is jiu-jitsu. That's one of it's something I describe or prescribe for my patients as a treatment if they are high stress, low proprioceptive. Because of course you get to stimulate the vestibular proprioceptive systems by rolling around. You've got a whole bunch of touch. You're in people's deep personal space, which is something most people nowadays, and maybe I'm overgeneralizing, but people really find getting in personal space really stressful. And this, I think, is made much worse by the devices and the phones and the computers that we're all doing our work on.
Yeah, you're right. Divorced from the rest of the world.
Correct.
But there is also, from the biopsychosocial aspect, something quite powerful to the camaraderie of the community of wrestling a dude for an hour and then trying to choke each other out, and then afterwards you're best mates. It's kind of like you go out drinking for someone for the first time and then all of a sudden you're best pals afterwards. That's something
absolutely.
That I think, again, Luke Curry was talking to me about. There was a paper where they looked at motivation levels amongst CrossFitters compared to average gym goers. And the motivation levels for exercises were like through the charts, obviously, for CrossFitters. Yep. It's the only reason why they do that bullshit in the first place. It was very much that sense of team culture and group camaraderie that...
So my question there is, were they highly motivated people to start with, or did the group drive their motivation to come up?
Yeah, that's a good point.
I mean, I can't answer the question. It just seems that people who are high kind of alpha type personalities gravitate to that sort of thing in the first place. But, literally earlier on, I was driving back from my breakfast planning, and there was this CrossFit gym. And I was looking at it, and I thought of one of my friends, and I went, I wonder about that concept of the belonging is really the reason people get, and hence it might get called a bit cultish from time to time, and that we're really doing it not for our fitness or otherwise, but because I now have a tribe. I identify with these people because I was actually a high anxiety, unrooted, so to speak, no tribe culture or otherwise. And I was thinking about it because this is a friend that I have in New Zealand and someone I deeply respect and admire, but they can actually interconnect with a lot of the culture in New Zealand. The Māori, they use a lot of words that I wouldn't naturally use, which are very New Zealand Kiwi orientated. And so they again were hunting in certain ways to integrate into something. It just, makes me wonder.
Yeah, that's all interesting points. But the other thing I wanted to bring up with you today, one thing that I do want to talk about is what, like step by step from our point of view, what someone with anxiety. Now, obviously, we're not trained psychologists, so everything should be run by your appropriate practitioner. If you're listening to this and you've got anxiety and you're thinking maybe it'd be a good idea to reach out. So no matter what, reach out. Find someone, anyone. Start with a friend. Start with a mate at the gym, a rugby club. Yeah. Well, why don't we talk about it now? Like the first thing that someone who's having a panic attack or that background anxiety is find that tribe that you can identify with, Even if it's another person with anxiety, to share your importance of tribe.
Absolutely. We need connection. From there, ideally, find someone who is actually sophisticated and capable with the right tools of helping deal both mentally and physically. The importance, if you feel bad enough, of utilizing pharmaceuticals cannot be overstated. The evidence shows that pharmacological support in the short term can be life-saving.
Yeah, that's why it's there.
Absolutely. So if you're in a really bad spot and your anxiety's that high, you're feeling suicidal, speak to a GP, speak to a psychiatrist, get some support that way. We know that boosting up serotonin levels is really helpful. We also know that a lack of serotonin is by and large not the cause of depression and anxiety. We know that if you give someone drugs to block serotonin, they get a boost in their cognitive performance equally as much as if you add and lift serotonin in their system. What's interesting actually is that the experiments done on giving antidepressants, etc., to people with anxiety and depression shows that you get about a 1.8 point lift in the Hamilton Depression Score. Now, what's really cool is that if you alter your sleep pattern, you get about a 6-point lift. Now, so we know that these drugs work, and we know that they are not the be-all and end-all. But there's several factors. Is if you're in a tight spot, they're a really good tool to lift you and hold you still while you get nurtured. And I think the connection is really the biggest thing that makes the difference. We know that long-term use of these drugs doesn't, once you get past a certain point, and I think it's like 24 months is max, you don't get any, or don't appear to get any greater lift in your anxiety and depressive scores.
That's interesting. Well, that makes sense from a neurological burnout point of view. There's only so long to drive those receptors before they need a reset.
And so you need to be seeking other support. Don't just rely on drugs. They will help you. But you need to utilize the services of that GP to go, right, can you send me to someone that I can talk to? Can I get a counselor? Can I get a psychologist? Can I join a rugby team? And again, that's actually one of the reasons why I send people for jiu-jitsu yet again, because of the camaraderie. But one of the reasons that I use it is people often have high levels of fear. There's been abuse in their background. They've been physically assaulted. There's nothing like training your body to get stronger and more capable to help get rid of your nameless fear. Like learning to be able to move and not just feel vulnerable all the time makes a huge impact on people.
That's beautiful.
Just my thoughts.
But because it's got to be, because that's almost getting into like the mindfulness meditation style. Like you need something to block out the fear of tomorrow.
Yeah.
And whether that's worrying about or learning how to choke out the guy that's attacking you, or learning how to.
Well, it worked for me. It brought my anxiety down.
Yeah. So whether it's a physical exercise of that nature, like Brazilian Jiu-Jitsu, martial arts, or any form of movement-based exercise, proprioceptive boost that gets you focused on the here and now, where you can't worry about tomorrow.
That's it.
Because, for some people that could be, going out and running a couple of K.
See, I don't recommend that one, and I try and stop my patients doing it.
Well, I just all forms of cardio to me are taboo.
No, specifically running, and there's a reason why I try and get them not to do that, because lots of patients will come and say, okay, I love running, and these are high anxiety patients according to their scores and their responses, and you go, right, okay, so I don't really want you to do that one because running's actually all about getting away, isn't it? And so when you're high anxiety, all you're actually doing is
point of view.
Correct. So I just don't see it as the right thing for someone who's necessarily high anxiety, because you could be reinforcing the motor patterns associated with being stressed. Now, so I'm sure there are other people.
Go for a short sprint, tackle someone, take a bite out of them, and because that's getting you, you're running.
The bite I was drawing the line at, but the rest of it,
okay.
Run and
the
footy,
and then just make sure So, look, thank you. You've helped me immensely with my anxiety today. And then sprint off and tackle the next guy, and then thank them and say, "Look, thank you, I feel much better." There could be something to that.
Yeah. So
I
just
certainly
in
know
case
that if I run up and kick my brother in the balls, I feel so much better afterwards.
that drops the anxiety. Just in case anyone was taking us seriously, this is humor. Humor.
Yeah,
This is the caveat here.
Go the bad way really quickly.
The waiver is there.
Conditions apply. There's an asterisk on every single word of this seminar.
Yeah, I learned
podcast.
something from dealing with Brett. We were meant to be sensible. Sensible.
That's probably we should start. I was listening to one of the other podcasts, and I think we probably let it go a little bit too much. Like, that could get us. Bugger it. It's out there now. Who cares?
Yeah, it's out there. There's no point getting too stressed. This is meant to be a bit of information, a bit of humour.
Fear of tomorrow. Don't worry about it.
Other things that I would do, obviously, I will look at someone's diet because, again, one of the things that I try and look at with all my patients, everything is brain-based. Everything is resource management. If you had the resources to do it properly, you would do a better job. So we know categorically that the network that is our beautiful nervous system requires building blocks. It requires B vitamins and proteins, and it requires iron, and it requires oxygen, and it requires all these good circulatory things coming to the cells to actually make the mitochondria work, to make the neurotransmitters actually talk, make the cells talk to one another, and actually sets off the responses. So again, if we think about making adrenaline, you require iron to make adrenaline. Okay? You require B vitamins to make adrenaline. You need the nutrients going in. So if you're on a really poor diet that's high inflammatory omega-6, so basically you've listened to whichever fad person out there that said, yeah, low fat's the only way to go, but if you're going to do it, get onto these polyunsaturated fats. So it's got no cholesterol in it. That's going to stop your heart attack, and that's great. Because that's kind of the message that you hear out there all the time. You know, low cholesterol is good and polyunsaturates is good. And so they're eating this fast food, let's call it that, or comfort foods because of stress. Because when we're stressed, our brains are really programmed to hunt for sweet and salt and fat because these are survival energy foods. And so, you know, think of a pack of crisps. That is ultimate food. It's full of fat, it's full of carbohydrates, and it's full of salt. Okay? But those low cholesterol oils, high omega-6, tip our ratios way the wrong direction and make us highly inflammatory. And we know that high inflammation and too much omega-6 is really bad for the brain.
It is, that catch-22 between the you crave the foods that give you that an initial immediate energy boost, but in actual fact driving you the wrong way as far as your background anxiety and cortisol levels.
What alcohol was being the favourite one?
The test we did on me as far as the stress cortisol levels go. What was
Dutch test.
Dutch test.
Yeah.
Dutch test. Yeah, that worth the money in my experience.
Absolutely, it's an awesome test. And again, it gives you a very practical ability to determine, you know, what all of your hormones are doing at that moment in time. And maybe it's not the most absolute. Some people will say that there's more accurate tests out there. Great, we'll do that one. But it's one I found very versatile. It's useful. It's easy to perform for the average patient. And it will give you a day snapshot, so to speak, of them. Now, from there, you can go and do something. And again, like in my daughter's case, after running it, we've got her on some adaptogenic herbs to try and calm the adrenal glands down. And we've got her on some herbs to try and clear the liver and the estrogen to try and get some of the hormones and the melatonin out of the system so that we can get a reboot going on. And I'm trying to get her to do more physical exercise, and I'm trying to focus on that psychosocial connection to give her an identity, because how many teenagers have a great sense of self? You know?
Yeah, good luck.
None of them generally are feeling really good about themselves. And then when they have this heightened chemical stress going on in the system because they don't sleep, it just winds and winds and winds. So again, for my patients, apart from the physical movement and looking at the basic diet, would take away, you know, high omega-6 foods, would take away a lot of the processed sugars and carbohydrates. I would generally find that most of my patients will end up off of things like gluten or dairy. Now, we'll trial them off it for a period of time, and then we can run blood tests or otherwise to try and see if they've got actual problems with it. It may be just that they were overloading on comfort food, so to speak, and they're not actually allergic or maladaptive to gluten. But, if you take gluten away from them for a period of time regardless, you can't just stop at the servo and pick up junk while you're getting your petrol on the way home. You can't quickly grab a snack. You actually have to stop and think. And stopping and thinking means that your drive to pick up comfort food goes down. I heard this great thing called the apple test. It's very, very simple. Brain says, I'm hungry, feed me. Other part of the brain goes, right, here's an apple. Do you want to eat that? Bad part of the brain goes, nah, mate, I want chippies. You're not actually hungry. You just want a hit of dopamine and serotonin. No. And so you don't eat. And I think that's a really neat kind of descriptor. One of my daughters will just...
Exactly like my 4-year-old.
Yeah, no, for real, because we're not really using our frontal lobes. We're using our kind of innate brain, let's say, the unconscious brain that wants another hit of dopamine. I want to feel good. Make it good for me. I'm stressed. And what we want at that moment is sweet, salt, fat. Oh, and guess what those evil biotechnologists did? To a degree I wish I'd completed. I was sharing a lot of the same papers at university when I went through. I did biochem and physiology originally, and I could, Auckland University Med School ran my course, as well as biotechnology had come out for the first time. And I was really intrigued by that course. And I now kind of, as I've gone on more into nutrition, I wish I'd actually done my major in biotechnology, specifically food science, because, that's the stuff that teaches us why do I want to keep hunting for that food when I know it's not good for me? And we know that these food technologies work upon our innate hunt to actually keep making us buy stuff that's not good for us.
Cheeky buggers. They've definitely got that science down, Pat.
Oh, so good. I wish I had no ethics.
I would make things easier.
I would make the perfect saleable food. You don't want this.
So in summary, anxiety attack or anxiety-prone people, do whatever you need to do from a pharmacological point of view to get out of Dodge.
Absolutely.
Find a tribe and a counsellor. Look at diet, take out all the crappy stuff, and then, if need be, start going down the rabbit hole of advanced testing to see exactly what's going on from a hormonal and a biochem point of view, and fix accordingly, and then find some form of physical exercise that is strenuous enough to get you out of your own headspace.
That works for me. That's exactly what I want people doing. Live in the moment.
As a nice little quick plug for your clinic, mate, do you want to talk about the importance of cryochamber therapy with anxiety? Hey, you're welcome.
Yeah, that was awesome, especially as we have a new one coming in, Cryomed. Thank you very much. We'll have one in the next 2 weeks, and I'll have far less anxiety myself, I can guarantee you, with my new cryo sauna coming. But no, realistically, one of the great things about cryo is it drops all the inflammation out of the system. So that 3-minute sudden cold, so you go from like 25 degrees to the chamber's minus 190 degrees back to 25, shunts all the blood around, and is shown to activate those sirtuin genes to elongate your longevity, alter circulation, alter the use of energy in the mitochondria, and make you vastly more efficient. Now, this is shown to drop all the oxidative stress out of your system, and by shunting the blood back out again, of course, your body gets a sudden boost in endorphin release from the circulatory tree. And as soon as you get a burst of endorphins, your brain goes, oh, I feel good. I survived.
Actually, I've got a mate who told me an interesting story just last night. He did this my mate who'll remain, he's never going to listen to this, but he'll remain nameless. History of bad depression.
Bob.
Yeah, Bob. So Bob's got bad depression for several years, to the point of hospitalisation. Then recently his missus of 3 years just up and walked out on him. So yeah, he's been better,
Okay.
but he did this thing over the weekend, which sounds insane when he was describing it to me. But now that I'm thinking about it, from that you survived something, endorphin release, it sort of clears your mental state point of view. It was kind of clever. But basically, what was involved, it's not camphor. It starts with a C, but it's basically a process or a thing that they do in the Amazon rainforest where they scrape the backs of poisonous frogs and collect the poisonous blah.
Yep.
And he was telling me how they make a quick burn on your skin and then drip this whatever it is onto the area. Makes you violently ill for 30 minutes. And then they do another thing where he did it's apparently the most pain you can physically go through without causing trauma to your eyeballs, where he did drops of this stuff into his eyes. And yeah, horrific pain for 3 minutes. But then on the other side of it, it was that endorphin release of, hey, I just went through the worst possible pain imaginable and I survived it. And there's that brain reset for now. I certainly would not suggest to anyone to go and do that, but I can understand the
why.
The why behind it from that brain reset point of view. Then you can start to see why some people do those magic mushrooms that get you as close to death. Is that the ayahuasca?
Ayahuasca is what they've been using in the Amazon rainforests, etc., and South America from a shamanic point of view to reset all the deep connections. There's some really interesting stuff out there on low-dose LSD for the same sorts of things because it reconnects portions of your brain that get disconnected. There's a few other things. Oxytocin nasal sprays might help in those particular instances, and that might be something which could be useful for people with real social anxiety and difficulty connecting to people because it helps make connections. There's really good research in the autistic kids. Whereby children...
Isn't that one of the rumours about casinos where they get oxytocin floating around their air ducts to make you feel all warm and fuzzy while you're throwing away your well-earned cash?
To be honest, I don't know, but it might work. It might, absolutely. I don't frequent enough casinos because I don't have enough money myself to throw away in a casino.
My one experience with a casino was in Vegas, and I started with $100.
Yes.
Played roulette, got it up to $450, and then was walking around with a couple of mates. And at the same time, there was I think it was like Pussycat Doll promotion or something like that, which is essentially blackjack, where there was a rather fetching lady in a bikini.
Yes.
As the dealer. And then, funnily enough, I could not focus on, two things at once.
Not enough blood in your system. You were high division,
I couldn't focus on three things at once. And funnily enough, my $450 went to $0 rather quick. So at that point in time, I decided, you know what? Gambling's not for me.
No.
But, yeah.
Yeah.
Yeah, but...
not for me either. I have children to take my money away quite so quickly.
But because from that brain reset or the mushrooms, I think in Amsterdam now it's now sort of under the same category as pot, like it's legalized to take some form of mushroom. I don't know that it's the ayahuasca, but it's a mild hallucinogen. And then I was reading another paper where they were starting to incorporate. Like mushrooms or LSD with cognitive behavioral therapy as being putting you in that highly suggestive state to sort of reset your
There's a whole lot of actual research done on it, and it's where it all started. But I will point out, of course, that there's equally as many people who have got to become highly anxious and cognitively defunct from experimenting with far too many mind-altering substances.
If
so
you're going to do it, don't do it sensibly.
Well, the problem that I see is that human beings have very little self-control, and invariably most of them probably have defunct frontal lobes in the first place, and therefore what seems like a good idea, a little bit of alcohol, a little bit of pot, a little bit of, suddenly morphs into a great big monster, and they eat their brain alive.
Yeah.
I've had plenty of patients who kind of started off having a bender and a party and then ended themselves in hospital with cognitive decline and never been quite the same since.
Yeah, well, that's slippery slope.
It is. Don't do it. Then my other favorite one, you have the psychiatrists who provide electroshock therapy to reboot people's systems, which, when I first heard about it was sounded a bit barbaric, but it brings people out of suicidal tendencies. Now, we put that down to it releases serotonin. I kind of, now that I've learned a bit more, I wonder if that's really much more about resetting the network and actually, helping drive people to experience something. Oh, I survived that, and then this gives a bigger rush to the whole thing. Because, there's nothing like getting electrocuted to make you think, oh my God, that was the worst thing that ever happened to me.
Well, I had a patient who had previously had that electroshock therapy. I believe it was for depression or anxiety. I can't remember 100%.
Usually intractable depression.
I thought it was interesting because, she pointed to the site where they applied the quote unquote therapy.
Yes.
And it was, interestingly, right over the parieto-temporal occipital junction, essentially where one of the major networks for sense of self and spatial awareness lives. And I'm pretty sure it's the posterior pole for your default mode network, which is sort of your resting brain state. Yeah.
Let's jolt that back into existence.
Yeah. But look, hey, if it gets you unsuicidal,
absolutely.
Better to be here than not.
I looked at some of that stuff. I think it's Jack Elder Robertson or something like that, who was high functioning Aspergic and had the high frequency magnetic pulse applied to his head and reset his entire personality and connected to his emotions from there. And then after a while, that sort of faded a bit into the background. But basically what he could take out of it in the books was that the electromagnetic field, this high strength field that was applied to his head, I think broke some of the connections in there and reconnected other parts in a different way, sort of reorganizing the network and allowing flow to change. And he kind of described what he'd lost as well as what he'd gained. He gained an insight into people's emotions, but he lost his ability to interface with electrical equipment. Like he could originally look at a machine of any respect and kind of innately know how it was feeling, how it was running, what was wrong with it, and how to put it back together again. And it kind of seemed like his brain had made the emotive connections to solid objects rather than to people. And after his head got zapped, he got more emotive, more people, and less. So this is the guy that designed all the fire shooting guitars for Kiss and was the roadie for Kiss.
Oh, yeah.
So all that original hardcore metal stuff that he did, he was worked for the Pink Floyd touring company. So a pretty interesting person, but he literally described himself as having chronic anxiety all the time, not really knowing what people were saying or meaning around him. So he never felt good enough or connected to anything. And after getting magnetic therapy, he was able to interconnect and manage his relationships a whole lot better.
Yeah, that's interesting. I was listening to a podcast where they were talking about there's this guy who, quote unquote normal guy. And
whatever that is.
Yeah, whatever. Yeah, you see generic white male. But started to develop sort of sexual attractions to people that are a lot younger than they should be. So and he sort of no, this is a problem. I'm now starting to get, aroused by, and this is so unlike me. What the hell's going on? So he ended up going and getting an MRI, and sure enough, there was a tumor growing in the pedophile center of the brain. Got it removed, and sure enough, the sort of sexual urges for youth went. But then cut to 3 years later, he started to notice those same urges come back. So went back and it had regrown, and then they cut it out again, and then it went away. So it just interesting.
Wow.
Yeah,
Well,
interesting one.
Shows how important the actual brain, the network itself is, rather than just the biochemistry. And I think if anything comes out of today's discussion, it's that I want people to be thinking about the beauty of the network and connection, both in the body as well as external in your environment and to your group.
External and internal connectivity. That's a rather touching way to finish the podcast, mate.
Oh, didn't we do well?
I think we did exceptionally. Look, we didn't manage to disparage any other professions.
Well done.
I think I swore twice. That's pretty good for
still
me.
time.
There's still time. But fucking, and there you go. Let's not. And no wildlife seemed to interrupt the podcast too much, unlike Brett's fucking cat last time. I tag him in this one and say, mate, next time we do a podcast, you do something about that cat.
Yeah.
Beautiful, mate. Any closing thoughts, closing remarks? Usually, you've got such zen-like sayings right at the end of the.
Oh, if only I had one. I mean, like one of my things again. There's never a moment for not choking someone, but that's more of a jiu-jitsu thing than a violent thing. I'm just pointing that out. As I said, that being in the moment in a 5-minute roll with someone really did an awful lot to help my stress levels in the last few years. There's never a moment not to consider glycerophosphocholone, GPC. It helps lower people's adrenaline and boosts their ability to make acetylcholine. And sit, talk, have a coffee, have a green tea. Take the time to be in the zone with someone and actually listen.
That's beautiful. That's beautiful.
Yeah. Right.
Find your tribe. All right, guys.
Okay.
Thank you for listening.
Thank you for watching. To learn more from Dr. Scott, visit our site at optihuman.com.au.